What if the most important thing you could do for your blood pressure wasn't during the day, but in the last 10 minutes before sleep? Many seniors take medication, avoid salt, and try to eat better, yet their blood pressure still rises at night. And most don't realize this simple truth: right finger nighttime habits strongly control morning blood pressure, heart strain, and stroke risk. Tonight, I'm going to guide you through a gentle, science-backed nighttime routine designed specifically for adults over 50. It helps calm your nervous system, relax blood vessels, and allow your heart to rest deeply while you sleep. Stay with me until the end, because the final step is what prevents dangerous morning blood pressure spikes. Let's begin. Tip 1. Dim the world around you about 30 minutes before bed. Begin lowering the light in your room. Bright lights tell your brain it's still daytime. That keeps stress hormones like cortisol active, and cortisol raises blood pressure. Soft lighting sends a powerful signal to your nervous system: it's safe to slow down. If possible, turn off harsh overhead lights, use a bedside lamp, avoid phone screens as much as you can. This alone can lower nighttime blood pressure within days. Tip 2. The warm relaxation drink. Now prepare a warm, caffeine-free drink. Warmth relaxes blood vessels. Relaxed blood vessels equals lower pressure. Good options include warm water, chamomile tea, ginger tea, warm milk. If tolerated, take small sips. Feel the warmth move down your chest and stomach. This simple habit gently shifts your body into rest mode. Tip 3. The leg elevation reset. Before lying down, sit or lie on your bed and gently raise your legs using a pillow or cushion. Just 2 to 3 minutes is enough. Why this works: reduces swelling in the legs, improves circulation back to the heart, decreases the workload on your heart. Many seniors notice their heartbeat slow down during this step. Breathe normally. No effort required. Tip 4. The blood pressure breathing pattern. This step is powerful and free. Place one hand on your chest and one on your belly. Inhale slowly through your nose for 4 seconds. Exhale gently through your mouth for 6 seconds. Longer exhalation activates the parasympathetic nervous system, the system that lowers blood pressure and heart rate. Repeat this breathing for 2 to 3 minutes. If your thoughts wander, that's okay. Just return to your breath. Tip 5. Shoulder and neck. Release tension in the shoulders and neck. Silently raises blood pressure. Gently roll your shoulders backward, slow circles. Then tilt your head slightly side to side. No force. No stretching pain. As muscles release, blood vessels open, allowing pressure to drop naturally. Many seniors carry stress here without realizing it. Tip 6. The calm mind check-in. Now place one hand over your heart. Ask yourself quietly, what went well today? It doesn't need to be big. A smile. A conversation. A peaceful moment. Gratitude reduces nervous system arousal and lowers inflammatory stress hormones, which directly affect blood pressure. This step may feel simple, but it's incredibly powerful. Tip 7. The sleep position that protects blood pressure. Your sleep position matters more than most people know. For many seniors, sleeping on the left side improves circulation. A pillow under the knees, for back sleepers, reduces pressure on the spine. Avoid very flat pillows that strain the neck. Comfortable alignment allows the heart to work with less resistance overnight. Closing message: if you want lower blood pressure, don't fight your body, guide it. This nighttime routine isn't about effort. It's about signaling safety, calm, and rest to your heart and nervous system. Do this every night, and over time you may notice lower morning blood pressure, better sleep quality, less nighttime anxiety, a calmer, stronger heart. Your heart works hard for you all day. Give it peace at night.